tell me the two things that are most important things you want to cover today regarding the assay itself. Okay, fair enough. I think the first thing is we'll specifically look to the development of the assay and maybe talk just a little bit about the systems, but just the assay development for the antibody-antigen reaction, which happens in immunoassay. Ortho had decided in the development for the emergency use development of this assay and use for the patients to use the S1 spiked protein for COVID-19. And the key thing about that, as I'm sure you probably already know, is that that's specific to COVID-19. It's only that. It's not the common cold. It eliminates cross-reactivity and false positives. So the quality of results and giving you confidence that a negative is a negative and a positive is a positive, you can't do much better than 100%, which would be able to deliver you that. And on your integrated 5600. So you'll be able to just implement that right in with your PCT testing and hepatitis and HIV testing that you use for infectious disease. So I know you have an architect in-house today, right?
Yes.
You could possibly run it on that. So we just want to do a little differentiation here, is just to look at, what did the other companies use for the antigen for the development of their assay? So to have a quality assay, you need to have a good system, good detection technology, and the right assay, the antigen, for the antibody-antigen reaction. So the architect, they decided in the development of their antibody test, which is only IgG, they don't have the total or the IgG, which we offer both at Ortho. They decided to use the N protein, which impacts quality of results because you could have cross-reactivity with potentially the common cold or other SARS disease, so false positives potentially. So how could a false positive impact the patient for you, your patient? How could it?
Well, I mean, it could give them a false sense of security.
Yeah, I mean, oh gosh, I have the antibody, I'm gonna go to church, I'm gonna go to the beach, and then I went and visited Aunt Sally at the old folks home or the retirement community. And that would create challenges, potentially. So using the spiked S1 protein, I think, giving you confidence of result that a positive is a positive, a negative is negative for COVID-19, we can deliver on that. So just look at specificity in general, 100% specificity, which we can deliver that. Gives you confidence in a town of 100,000 and 5% positivity rate, you're going to test positive. When you have a specificity just 10 points lower than that, you're going to have quite a few false positives, and that just creates challenges downstream. Just think of it, reporting to a health department of positives that are actually negatives. What are the downstream impacts of that for you and your reporting and your staff? Just think how much labor that would involve. So 100% specificity on our total assay and 90% specificity, sensitivity on 90% sensitivity on the IgG and 100% on the total gives you confidence in results. And if you look right here, I think it's interesting to look at this. If you look at the 100% sensitivity and specificity, or 90% and 100%, look at the positive predictive value we can deliver with our assay, and then look at that with the architect. Why do you think that their positive predictive value is so much lower with an assay that is both 100% and 99.6? Why would you think that might be like that?
I don't know. You just shared maybe the N protein target, right?
Maybe they have some false positive because of cross-reactivity. Maybe. So you'd have to kind of think about that. But when you're looking at positive predictive value of 100%, confidence in results is what you get from your vitros products. And then some things that people ask are, what are the guidelines that the CDC has put forward. We have the assay that under EUA. Use a test that gives you a positive predictive value, very high. We can't get much higher than 100%. And then the three things you look for, again, positive predictive value. Use a test that maybe gives you an option of using a total in an IgG. Ortho offers that. And so, do you think there's any other questions that you might have with regard to the quality of the assay?
No.
Good.